presentation.
Okay, so everybody, this is Hannah Waraway, and she's going to introduce herself, although you probably have seen her on campus. And she'll introduce herself and her topic, and you have 20 minutes, and then I'll open it up for questions.
Perfect. All right, can everybody see the screen before I introduce myself? Okay. All right, so like Mary said, my name is Hannah Waraway. I am a senior here at Midway University. I'm a dual major in equine management and rehabilitation with a business minor. I've been riding horses forever, and I probably have one too many jobs. But at any rate, I am here to present to you understanding the power of proprioception and how it can affect our daily lives and our horses' lives.
Nice picture.
Thank you. All right, so before I define this for you, I want you to think about the last time you were carrying something and you were walking down the stairs. Did you have to peer around what you were carrying and look at where your feet were as you descended the stairs, or were you able to comfortably walk down the stairs because you were aware of where your feet were? If you were able to walk down the stairs without looking, you made use of your proprioceptive system. So proprioception is derived from the Latin word meaning proprius, meaning one's own. So roughly translated, proprioception means one's own perception. It's the spatial awareness of oneself from head to fingertips and toes, or for horses, from the head to the trunk to their hooves. So the goal of proprioception is very aptly described by Narelle Stubbs. She says it is the intention to increase the joint mobility and to activate and strengthen muscles required to move the horse's body to the desired position, to promote intersegmental joint stability, to restore functional locomotion and performance. So overall, proprioception is the body's ability to move fluidly and in balance without looking. Just a quick historical overview. Sir Charles Sherrington in 1906 classified 3 categories of proprioception or perception. There was exteroreceptive, which is cutaneous, so everything externally that we can feel and sense. Interoreceptive, which implies visceral, so internal organs. And then proprioception he classified as the deepest level of a human's perception or level of awareness. He also classified this as our sixth sense. So when we talk about proprioception, there's 2 different types. First, there's conscious, which conscious is the more complex, cognitively thinking about our body position, our movement. So an example of this would be trotting through poles, maybe 4 poles. The horse has to think, am I going fast enough? Am I lifting my leg high enough? Is my knee flexed enough? Pastern, fetlock, so on and so forth. And then we move on to the unconscious proprioception, which is a more basic understanding of how our body moves, so your locomotive skills, your postural balance, and skills of that nature. So take away the trotting poles and just have the horse trot in a straight line. Does he know where his feet are? Does he understand as you move through the diagonal 2-beat gait that he needs to track in a straight line? Does he have proper balance? And even though this is more basic skill, this is just as important as conscious proprioception, because without the fundamentals of your balance and your posture, you're not going to be able to move through the more complex exercises that conscious proprioception will require. All right, so a little bit of the mechanics of proprioception. So through proprioception, a horse can sense variable amounts of pressure. So I want you to think about when a rider squeezes their outside calf and gives slightly in their hand and asks the horse to move out and increase his speed into the extended trot. The horse will then move into the extended trot, right? Because the horse and rider have both made use of their proprioceptive skills in that the rider knew the precise amount of pressure to apply to the horse's side. And as this contraction happened, the horse understood what that pressure meant and moved from the working trot to the extended trot. Another thing horses can sense through proprioception is tension in their body or the rider's. a rider's aids or lack thereof, and how effective their aids are. So I want you to look at the two pictures that I have here on the right. I was able to attend BreyerFest a year ago, back when COVID wasn't a thing. And I was lucky enough to watch the Trixie Chicks perform, which, if you know the Trixie Chicks, they are renowned trick riders all across the country. And as I was going through old pictures, I thought of this presentation, and it describes my research perfectly. So a horse with sharp proprioception will be able to know exactly where his feet are at each stride, and also be acutely aware of the rider's position, even if the rider is severely unbalanced, like this, where you have a rider hanging off the side of the horse. That should not be possible, and would not be possible without the use of proprioception on both the horse's side and the rider's side, and a significant amount of trust as well. All right, so the benefits of proprioception training and rehabilitation: it increases your range of motion, your overall awareness and coordination in both riders and in horses. It decreases the risk of injury, so if you know where your feet are, you're less likely to make a mistake or misplace a foot or misplace a hoof. And it also can increase muscle strength and tone. So in this picture here, we're going to get into different rehabilitation techniques here in a second, but this lady is using cavalettis, which are just raised poles, and she's actually got leg wraps on. So she's using a type of tactile stimulation here to increase the horse's awareness of where his feet are while going through a set of poles or cavalettis. So before we get into how we can increase proprioception and how we can actually develop proprioception, we have to be able to manage or eliminate, if possible, proprioceptive inhibitors. So the top three that I found, which there were more, but the three I want to talk about and focus on were pain, lack of rider balance, and surgery or injury. So pain is one of the biggest inhibitors, as it will alter neuronal pathways. So a horse with chronic tension and chronic pain is going to have all sorts of compensatory patterns and not know what the proper balance is, what the normal homeostasis is. So I want you to think about the last time you got up from sitting for an extended amount of time and you found that your foot was asleep and you couldn't feel where your foot was on the ground. You actually had to look. Maybe you had pins and needles go up your leg. It's not comfortable, right? So these horses can experience this too. And an example of this is using an ill-fitting saddle on a horse. This can cause numbness, decrease muscle tone, so in our words, atrophy, hypertrophy in others, so just an increase in muscle mass that's abnormal. So I want you to bring it back. So if I were to tell you to run 2 miles every week, and I'm going to give you a pair of tennis shoes. I'm going to give you a pair of tennis shoes that are too tight and they pinch at your heel. So after you run every day 2 miles for a week, you're going to complain that you had blisters for the first few days, it wasn't comfortable, and by the end of the week you probably had some resulting numbness from your body trying to acclimate to that amount of pressure, that abnormal amount of pressure on your heel. Now if we take this back and apply it to a horse that's being tacked up repeatedly with a saddle that does not fit their shoulders, doesn't fit their back, they will start to develop this numbness, and it will become habitual for them. They will know no different. So as a therapist, it's important for us to try and convey that, you know, we can increase proprioception and all of that, but unless we get rid of these inhibitors or try and decrease the amount of inhibitors we have, we're not going to actually make that much progress. So the second inhibitor I want to talk about is lack of rider balance. A couple of weeks ago, I was able to attend a clinic with Ann Krasinski, which, if you're not familiar with Ann Krasinski, she's a 5-time Olympic rider, very well renowned and well respected horsewoman all over the world. And one of the things that she kept drilling into us was that if you can't control your own body, how can you expect your horse to control his? It's that whole idea of what you put in, your horse is going to be able to put out. And he will only be able to match your level. So if he's constantly having to try and compensate for your lack of balance, how can you ask him to work through his proprioception when he's trying to make up for your lack of proprioception? And then the last type of inhibitor I want to talk about is surgery or injury, one of the most common. So when you have surgery or have an injury, most likely you're going to have a loss of muscle tone, you're going to have negative muscle memory, so that would be your compensatory pain and patterns, and then you'll have a decreased range of motion. So 4 years ago, I had ACL surgery on my right knee after tearing my ACL in a lacrosse game. I went into the surgery knowing that the doctors were going to fix my knee, and then I would come out of the surgery having pain, but also knowing in my mind, because I have reason and I have logic, that I will be able to recover and I don't have to compensate for it anymore. Where with horses, they go into surgery, we lay them down, we knock them out, and they come out of surgery still thinking they're in that state of tension. They're holding on to those compensatory patterns because they've been compensating for so long. So as therapists, now we need to regain that trust with them and help them through trying to figure out how they don't have to compensate anymore. So that can be one of the struggles as you're trying to go through proprioceptive training, is trying to work through that chronic state of tension that the horse held for so long. All right, so there are a bunch of different rehabilitation and training techniques that you can use. I just pulled several that I thought were the most applicable. Tactile bracelets is classified under tactile stimulation. So tactile stimulation is just the act of stimulating the superficial muscles. So on the horse's trunk, we have the cutaneous trunci, which that's the big sheet muscle that we're going to see when a horse fasciculates if there's a fly on their back. So that's the twitching that you kind of see. So tactile bracelets, I have a picture on the next slide, but they are small little anklets that you place around the horse's pastern. And they can be spur straps, bell boots, hair ties. They can be homemade. It doesn't have to be store-bought or a veterinary brand or anything like that. But basically, that's just going to increase the horse's awareness of that hind limb or that front limb that you're putting that bracelet on. So for humans, it would be the equivalent to if I start wearing a watch on my left hand. I've never worn a watch on my left hand. For those first couple of days that I'm wearing it, I'm going to be hyper aware and hypersensitive to that watch. So that's basically what the tactile stimulation, the tactile bracelets are going to do. So with the weighted boots, this should only be used under veterinary supervision because a lot of people tend to put too much weight on the boot too quickly, when in reality you only need about 1 kilogram or less to affect the horse and increase that flexion in the knees and the hocks, stifles, so on and so forth. Exercise bands, some of you may know what the TheraBand looks like, but there's a special saddle pad that's got buckles where you can take a band underneath the horse's belly, and then you can also take a band around the horse's hindquarters, so right around his hamstrings, so his semimembranosus and his semitendinosus, and you can actually increase the tension on the bands, which will increase the horse's awareness and ask the horse to engage his hind end and his core as you're riding or as you're lunging. One thing that vets also should only be allowed to supervise or should be done under veterinary supervision are the use of balance pads. I know Spy Coast, I've talked to a couple people over there, they have a couple of neurologic cases that come in and they actually use their balance pads. So the balance pads are little squares. I have a picture on the next slide. They're little squares that have some give. They're like memory foam, but a little stiffer in their give. And basically what that's going to do is you're going to put it underneath 1, 2, or all 4 of the horse's hooves, and he's going to have to constantly be aware of where his postural balance is, and he's going to constantly have to engage his core to maintain that balance. One thing we as riders, owners, trainers, anybody can do is do our horse a favor and take them out on different types of terrain. The arena is great for flat work, anything that you're trying to accomplish in the sandbox, but it's flat, it's consistent, So your horse will not be as aware as where his feet are as he will be if you take him out on hills or a trail ride where you experience multiple different types of terrain. So the more you can get him out on various types of surfaces, the better off his proprioception will be, because you're constantly asking him to be aware of his hoof placement. And then from all the articles that I read, ground poles and cavalettis were the top technique to use to increase proprioception. Ground poles and cavalettis are great because their effect never wears off, like the tactile bracelets or weighted boots can. After a certain amount of time, that tactile bracelet's not going to have any effect. Same with the weighted boot. The horse will become acclimated to it, and it'll just be another thing that you put on her leg. Ground poles, cavalettis, horses will always have to lift their foot, always have to make it over the pole. Otherwise, they knock into it, and that's not a pleasant feeling. All right. So on the top left-hand corner, we have a TheraBand. You can see that black saddle pad has two clips. One has a band running underneath the horse's belly, and one running behind the horse's hindquarters, right on his hamstrings. And this can be used under saddle, lunging, hand walking, groundwork, any kind of groundwork. Really, it's at your discretion. And then the picture in the top right-hand corner is an example of a balance pad. Here they have this horse standing, his two front feet on this balance pad with a good amount of give. You can kind of see that his hooves are impressioned into the pad, but he's not on the ground, so he still has to maintain that balance and use that conscious proprioception to understand where his body is and where his weight distribution is. And then across the bottom, we have 4 different types of tactile stimulation. The 2 on the left are tactile bracelets with no weight. And you can see in the second picture from the left that there are little plastic chains dangling from this tactile bracelet. And that's just going to increase the horse's awareness even more. That's a really weird feeling to have something dangling around your feet. So he's going to pick up his foot a little bit more and increase that flexion. The 2 pictures on the right are weighted tactile bracelets or weighted boots. And even the one on the far right has got that tactile stimulation, in that it has those plastic chains, and it also has a little bit of weight added to it. All right, so last but not least, one of the most important figures in this whole problem is riders, trainers, and owners. As a therapist, I can do everything in my power to try and increase your horse's proprioception, but unless you do your homework, it's not going to ever improve. Proprioception is an ongoing process where you always have to be working on improving your own balance, your own posture, and your horse's. So work on improving your balance, work on improving your weight distribution. One of my favorite things to do is have people stand on a scale, one foot on the left, or one scale under the left foot and one scale under your right foot. I can tell you right now that my left foot is going to bear more weight just because I did have that knee injury in my right knee. So I automatically still, even after 4 years, still put more weight on my left leg just because that injury was in my right knee and I had to guard it for so long. So as riders, we need to identify where we compensate so we can understand why our horses might be compensating in the way that they do. You know, if I lean more left because I put more weight in my left stirrup, does my horse drift left? Does he drop his shoulder to the left? Does he drag his hind end to the left? You know, all these things can be caused by humans. So half the battle is trying to figure out where your proprioception is at and what level you're at, so that you can better decide what your horse needs and what kind of proprioception training you and your horse both need. So then try proprioception activities with your horse. There are so many different techniques that I didn't list because I don't have time to. But pole work is one of the best ways to improve proprioception. Go out on different terrain, make a trail day where you walk around the barn, or you have an arena day and then you do a hill day. You know, it doesn't have to be a set treatment plan. It'll be different for every person and every horse. But try and be proactive in your exercise techniques. And then you can also use a TheraBand or the tactile stimulation. Those tactile bracelets are super easy to make. There was one study I read that used a bell boot on horses that were inherently asymmetrical in their hind end. So they used the one bell boot on the asymmetrical limb for 10 minutes every day for a week, and then it added up to a month. And then they reevaluated and found that the horse was not asymmetrical at all after they did that training with that bell boot. So a little bit can go a long, long way. Alrighty.
Fantastic. Does anybody have any questions? I hope you're thinking about your own body at this point.
So you touched on this a little bit already, but can you tell us some of the symptoms you might see if a horse is struggling with their proprioception?
Yeah, so a lot of times a horse is going to be tripping or maybe rope walking in the front legs, dragging his toes, stiff in his joints, just kind of not focused on where he's at. So for anybody that doesn't know, an example of this, my pony over the summer had a minor case of EPM. And as the weeks went on, before I had it diagnosed, I noticed more and more that he just wasn't as aware of where his feet were. You know, I'd pick up his foot to pick it out, and then I'd drop it, and usually he catches it before it hits the ground, but it was just hitting the ground. He was dragging these toes and actually squaring off the toes and the hind end. So it's just little things like that that you have to notice.
Anyone else have another question? It's a fascinating topic and one that is slowly being made aware to all horse owners everywhere, I hope. It's something that humans need to be aware of, as well as living beings, and how we treat them, and reading them and understanding them, and then as therapists helping them recover from surgery, like you said, or an accident, or a compensatory pattern, maybe a tooth. So yeah, this is a very fascinating topic, and it goes right along with our rehab and therapy work. Anyone else?
I have another question for you, Hannah, since nobody else wants to do anything, apparently. Okay. So do you tend to see more proprioception issues in the front end or the hind end? And if you see a difference, why do you think that is?
Ooh, pulling out the hard questions. I would have to say I see more issues in the front end because of a lack of proprioception in the hind end. So usually when I'm looking at a horse, I identify a proprioception problem in the front end. And as I'm kind of piecing the puzzle together and watching the horse more and more, I'm realizing that the front end is a symptom of the hind end lack of proprioception. Usually I see the pelvis and kind of just a lack of engagement in the hind end can result into tripping on the forehand because, all their weight is on the forehand. But usually I would identify a forehand issue before I would identify a hind end issue, just because that's where the symptoms usually present itself.
Well, there's also, go ahead, Jennifer.
Well, I was just going to say, I would agree that I think a lack of engagement in the hind end creates a lot of, you could give a whole talk on that, but that creates a whole nother set of issues that I think a lot of horses, if they're going to drag, it's going to be behind. And then, like you said, that'll lead to problems in the front.
Yeah, you can take an example of a horse that has ulcers or gut pain and how they hold themselves when they have gut pain. Their abdominals are tight. They tend to tuck their pelvis a little bit. Just think about yourself when you have a upset stomach or you're having a GI tract issue, how you kind of hunch over and hold yourself. You're not free and open. And this pattern of, again, compensating for pain and holding tension can then take away some proprioception. And once we get the ulcers solved and the gut pain goes away, that compensatory pattern is still there, and we have to re-educate with proprioception techniques and equipment. So, yeah, lots to consider with proprioception for sure. Anyone else?
Like at least one of these students has got to have a question for you, Hannah. You guys can unmute to ask a question.
Got a question.
So I have a question.
Go ahead.
Can you hear me okay?
Go ahead, Lucy.
So when does it come to a point where you go through the diagnosing and the tactile devices and the therapy, when you start looking for neurological problems?
Hannah, can you hear that?
For the most part, I think I got it all. That's a tough question. I honestly would immediately look for a neurologic issue, implement the proprioceptive activities that I could do to test where the horse's proprioception is, and kind of mix and match as I'm finding things. I would look for neurologic first, and that was one of the first things the vet that I had out to look at my pony. I kind of explained what was going on. She looked at his proprioception a little bit, or lack thereof, and then as she was finding a lack of proprioception, she was leaning more and more towards neurologic. So pretty immediately, she started testing for neurologic. She was moving him through some neurologic exercises.
Yeah, you have to confer with a vet on this. If you're thinking, is it proprioception issues or is it neurologic? There's a fine line there, and if you're not sure, you need to consult with a vet and have them rule it out for you. Anyone else? Well, Hannah, this was exceptionally good, and you sounded like a professor yourself.
Thank you.
I know that you love to teach. You found that through this semester.
Yeah.
And I hope you continue on that path. Excellent presentation.
Thank you.
You're welcome.